welcome and thank you very much for being here. This is a collaboration between uh, SDSU CEAL and PsychArmor to support military family caregivers. I'm just going to quickly read the what we're intending to do. During Healthy Aging Month, we honor the caregivers who stand at the forefront of aging, longevity, and resilience. Among them, military family caregivers shoulder unique challenges caring for loved ones with visible and invisible wounds of service while navigating ongoing issues of aging, trauma, dementia, and complex health systems. This 90-minute virtual event brings together San Diego State University's SEAL, the Center for Excellence in Aging and Longevity, and PsychArmor for a timely conversation on partnership, innovation, and community impact. We are really blessed to have with us on this webinar Dr. Tina Atherall, Dr. Qwynn Galloway-Salazar, Dr. Umar Latif, myself, and Michelle Matter. And they'll all introduce themselves later as they speak, but their bios and stuff will be on the website as well. And the session's intended to explore how military caregiving intersects with aging across the lifespan, where gaps exist in systems of care and how collaboration can address them, lived caregiver experiences that reveal the urgency of action. This is not something that we can keep postponing and get to next year. And finally, opportunities to share a new vision for caregiving training, peer support, and policy. So again, I'm Steve Hornberger, the co-director of the Center for Excellence in Aging and Longevity. I have the dubious task of moderating this, and I feel like that old expression about herding cats is going to happen in this meeting because each and every one of these people on the webinar is outstanding in their own right, and they're full of information and knowledge to help caregivers and military family members. Um, what's important here is how this issue has been on the sidelines for so long, and yet it's deeply personal. You'll hear from some examples as we go on, but I just want to add my personal ones now. My father was a military vet, was in World War II in the Ticonderoga, and lots of things happened to him there. And some of them he shared, but most he never talked about. Um, and when he retired at 65, 6 months later, he wound up having a stroke. And for the next 3 years, he was moved from VA facility to VA facility to VA facility. Um, all the while, they were practicing and experimenting to see more innovative ways to help deal with stroke. And my mother was just petrified. All she did was want him to come home. And that never happened. He went from 270 pounds to when he finally passed 2 years later, he was at 180, so he was just there in bed. Fast forward to now, my 92-year-old mother-in-law lives with us. She was a VA, retired from the VA, and we've learned a whole lot more since my father's time to Joanne's time, who grew up in the Depression, and she has a full day every single day. She eats 3 meals that she picks and makes. She has reads 2 hours a day, naps, really important napping for her, and then watches all of the political channels because she argues with me and Nancy at dinner every night about politics and why certain things aren't happening. Um, and in that span of 30 years, we've learned so much more about how to provide a quality of life as well as how to care for people so that being older is not loss. Being older is something that you aspire to, and not everyone succeeds at getting to be older, nor having a quality of life while older. And that's the intent of this webinar, to begin to share that information. Now, as we move into the perspectives, it's two worlds and one mission, because both. So I'm going to give Tina, why don't you give the PsychArmor first, and then I'll give a bigger picture for SEAL.
Okay. And I'll interconnect really just the great story of people coming together, because that's really it, right? It's really as much as we want to say it's also about the process and about systems that are set up, it's really about the people. And I think that's example of who's here. So first off, for those of you that are with us that may not know about PsychArmor, or those that will watch, PsychArmor is a nonprofit organization that works across communities to help individuals that are either supporting the military connected community or may be a part of it to really understand the different nuances, not only about culture, but also about the systems. So, in particular, when we're talking about this topic, it's really important to understand that a military connected individual is navigating between multiple systems. And there's a lot of words and branches and things that go with that. So the most important thing to know is that when you're dealing with someone who's military connected, first you need to know that. So at PsychArmor, no matter who we're working with, whether it's healthcare providers, it's employers, it's community members, like knowing the great team at SDSU, it's always about saying, like, do you know who the military connected individuals are in your community and in your planning? And what do you need to know then after you've identified that? And so that's really the center of this conversation. I want to thank Steve as a professional within the field of social work. I was a newbie back to San Diego, leading PsychArmor. And through our shared connection with the social work network, he started asking me questions about the work that we were doing, in particular here in San Diego. As you already know, he's a huge East Coast policy guy. And he also started infusing things that were going to be important in the coming years around our aging population. And so I'm a person who's extremely curious, and really do believe in the 10X. Like, what do we need to know that is future, future, future in front of us? And Steve's conversations to me in the beginning, back in 2019, well before the pandemic, started to infuse for me not only what were they doing at SCSU, what were they doing in terms of community modeling that they wanted to look at for the future, and how did that overlay what we were doing in the military population. So, military caregivers. Over 10 years ago now, guys, fact check me on this. Rand came out alongside Senator Elizabeth Dole and the Elizabeth Dole Foundation to tell us what these things were, these individuals were that were hidden heroes or caregivers. And there was a number thrown out at that time, 5.5 million military connected caregivers. The new RAND report that came out in 2023 states 14.3 million military and veteran caregivers in the US. I have to shout out, we have an expert that's actually sitting in our chat, Leah Christensen, who has built the system within VA. So anyone might want to tag her and find her and ask her questions later on, but really helped guide this in terms of a large strategic initiative around VA and looking at who are these individuals who are caring for our veterans, is why is that important? Not just important around the veterans, but it's also important around the caregiver. So think about this based on our new numbers. That means that there's like 5.5% of the US population, US adults, I'm sorry, are caring for a military connected individual. And the other thing that was crazy about the RAND report that I loved, and I can give a little framing around this in just a second, is that 74% of those giving care, being caregivers, are for over the age of 60. So dial back, as Steve wanted us to share a bit of our military connection. My grandfather was a World War II Army officer. My father was in the Navy, and I had the pleasure of being married to a Marine for a long time. So I understand the military life as it comes to being a military family member. And each of those individuals brought different, unique contributions to my life and watching as they aged, and in particular, being a part of my father's end of life journey. And although he was identified within the VA, the things that we needed in place at the time of his rapid hospice care were not in place. So therefore, we did not have the system that we needed to be able to support him at no discount of the VA at all, on discount of what we needed as his family members to know well before this moment of end of life. At that point, I was already working with Dr. Qwynn Galloway-Salazar on building out really what does caring for veterans at the end of life look like. And little did I know I would be going through that same experience. But something was happening for us at PsychArmor. So we have over 10 years worth of work in building out a portfolio of care alongside, and I have to keep saying it, Leah Christensen, who's on this call now, really helping us guide us to say, this is what's growing along this immense community of caregivers that are a part of this caregiver support program that have been identified. So imagine those that have not been identified. What do they need to know? Where do they need to go? And how do we support them in this journey as caregivers? Something that's going to be a thread of everything that we're talking about here. We would join the calls within different communities. So in the VA, it's VISNs, right? So these VISNs of care would bring in their caregiver communities, and guess who was showing up on the line? It was community members that were working in aging and longevity care. Unlike where my particular story came from in terms of being a caregiver, was understanding what it meant to be a caregiver for a younger service member right after they were wounded or injured based to some sort of line of duty. And there's also this perception that it is the individual that's coming back from combat or training or something like that, that caregiver story starts. It may be, but if you look at the numbers, we're looking at caring for veterans that are 60 years and older. Not that there's not a percentage before, but the higher percentage is that. And the community that was showing up that needed support and services from PsychArmor in terms of education was the community that was working in Alzheimer's, dementia, long-term MSK type needs, like what's happening with their body. And so we started to ask the team alongside the questions that Qwynn was bringing to us. Gosh, what do we need to know? What do we really need to know about what the community needs? And do we actually have that? Do we have the training that we need? Do we have the resources in the community? So this is where it inserts back to this great relationship with SDSU and SEAL. It's that they have built that, and they have built this amazing model for caregivers that can be applied to our military and veteran caregiver community, as well requires our community to be inserted into their model. And so that was one of my questions. Hey, wait, team, how's the VA with this? Where are you intersecting? And we once again found this gap. Like, oh, well, we're not exactly. So we're like, game on. This is why we're here today, because we truly believe that there's the system here that needs to be integrated. And as much as we can do, help guide people in connecting where they need to sooner than later in that pre-planning. Again, we've been asked often to be like, hey, so if you're thinking about aging longevity or this aging in place, could we be working with family members well before they need to make decisions so that they're actually into the system? I also love the community model. What San Diego is doing and what policy is being looked at based on this activities within SEAL. We need to know this in our military connected community because we need to know what's out there for us and what we need to be connected to within our community versus just thinking about our systems within VA. So it's a really important part in terms of making sure that the two worlds are connected. During my time within active duty, we used to always have this thing about, are we talking to our friends on the other side of the gate? That's what I would say is the challenge here, is our military and veteran caregiver community and our veteran community in itself, when we think about the demographic being older, are they actually looking now on the other side of the gate? That could be community, or that could be a VA that they never once thought was there for them, that's there for them now, right? And how do we help make sure that they get to them? So my last little nugget is I am proud that I have a daughter that is a social worker that's worked in hospice and palliative care here in San Diego, and she validated this need for this integrated approach. She said that if she knew that she had a veteran that she was caring for at end of life or that needed palliative or hospice care, she knew she had resources because she knew that she had the VA representatives that she could call. If she didn't have a veteran, she had less resources than she did if she had a veteran client. That's the other thing that we've learned at PsychArmor, which is why the conversation of culture is so important. That if you're asking that question, you're identifying their veteran status, you have more resources. Potentially, I understand that there's barriers to that, but we want you to be excited about it and at least know who you can go to that are the experts to help you get those resources that you need for your family, your loved ones, or the people that you're caring for. So, Steve, I'm going to pass it off to you.
Wow. Thank you. I now know what people mean when they say you talk like a New Yorker.
I had
Beautiful.
enough time there.
Yes, you did well. And also for those of you who are interested in the RAND report that Tina highlighted, it's the link is in the chat for you to download it for yourself. Now, I think Tina is correct when we talk about SEAL and the Center for Excellence in Aging and Longevity, because we see ourselves as being community driven and community centered. We're a very different kind of academic entity. None of us care about tenure. And actually, none of us will ever get tenure. None of us are doing research in terms of creating a career. We're doing research, and all of that will be on our website that you'll see at the end to help inform an organization. So, like, we're working with an organization that wants to create shared housing between older adults and college grads. So we did a research project that's on the website about shared housing across the country so that they can have the best thinking as they go about their design. SEAL has five big areas, and I won't go into any of them. They're all on the website. One is RON, which is a Regional Aging Research Network. What we discovered when we were getting started was that uh, people were doing all sorts of work in this field, but nobody knew about anybody else. Everybody was just in their own little silo or in their own little corner. And so we literally created an inventory of about 40 different projects that were underway at the time. We developed some criteria in order to continue to work in a more collaborative way. And here's an example of how we're different. We obviously selected a faculty member from SDSU and a faculty member from UCSD because they're just brilliant in research to be co-chairs. But to keep it focused on community, we also had a CEO of Meals on Wheels to be the third co-chair so that everything that they did was focused on the community, not so much about academic pursuits and academic interest. And they're different. I mean, there's an overlap, but there's a difference. And we're trying to make sure that the academia helps us develop new knowledge, but how does it become applied so that we can improve the quality of life for older adults and those who care for them? A second issue would be age-friendly university, where SDSU has become one of 80 universities across the country that is designated as age-friendly and has a commitment to lifelong learning. If that's of interest to you, if you go to age-friendly university, they have 10 principles, and as long as you commit to those 10 principles, you can become an age-friendly university. The third would be research. No, research we did would be longevity, where we're trying to understand um, this extended lifespan that we have. I'm always amazed that students, when I teach one class a term, they're flabbergasted when I point out that by 2030, one in four people in California is going to be over 60. By 2035, it's estimated that worldwide, there will be more people over 65 than under 18. Fundamentally, all developing countries, and then ultimately in the middle of this century, all countries around the world will be older. The question becomes, what's the impact on society? What's the impact? Simple example, we're going to have five generations working in large organizations. I don't know about you, but some of those generations don't get along well. Um, the other issue is workforce, and I'll spend a little time here. We trained over 7,200 caregivers in just under 2 years because there's such a shortage in caregivers, whether in-home or in institutions. The estimation is we're going to need another 10 million over the next 10 years, as well as another 6 million to replace what we have. Currently, if somebody starts, if 100 people start as a caregiver in an organization, 9 months later, 70% of them are gone because there's that much turnover. The job is difficult and lots of not enough support. Out of that, we decided that we needed to create peer support programs to help people manage just the stressors because with the workforce shortage, it's not like the agencies can help them manage the intrapersonal issues that come along with being a caregiver. It's not easy work. It sounds like it's easy, but uh, there's a lot of stress. Too many, the one statistic I saw was two-thirds of people who are caregivers are at or just below the federal poverty line. they're not getting paid well and they're doing essential work. Uh, in order to help build that, besides training the front end, we're also launching a certificate program in aging leadership in January. And so if you come back to our website, I think, Michelle, I think it's October 15th. You can join. We've got 4 classes, and I'm proud to say we got the president of California Volunteers for AARP to teach 1 class. We have a CEO of a local dementia care program to teach 1 class. We got the vice president of another large organization to teach a 3rd class because, and then Michelle and I will teach the 4th class. And we really focused on helping people develop the capacities and competencies, but also within the changing process that we're going through. Because here's some stats. If you make it to 65, but for an accident, you're almost guaranteed to make it to 75. And if you make it to 75, but for an accident, you're almost guaranteed to make it to 85. People talk about this extended lifespan as, the longevity dividend. The question is, how do we want to use it? Do you want to use it like my father, where he's just was bedridden in a hotel, in a hospital and a nursing home? Or do you want to use it like my mother-in-law, who's pretty active? She's got mobility issues, but she's as sharp as a tack, and she feels very involved in the world around us. And that's what we're trying to create here. And then because I guess the other statistic in terms of longevity, it was estimated 2 years ago, I saw that all children in America under 3, 7 out of 10 are expected to live to 100. That's just a staggering number. And the question is, how do we want to prepare? Now, that's the focus of SEAL. Our focus is involve, inform, inspire, because our goal and our mission is so that everyone has a long life of health, opportunity, and purpose. Because we're trying to, frankly, revisit or reframe aging from something of loss and decay and decline to something of preferment. How do you want to spend your days? Like my mother-in-law, she's an inspiration for me. Though I'm learning much more about growing up in Pittsburgh than I ever wanted to know, the rest of the day is just a joy. Um, and so with that in mind, I want to open it to Qwynn and Umar. I know I'm supposed to call you docs, but you're like friends by now. And so to the voices of leadership. And Qwynn, I don't know if you or Umar goes first.
I'll kick us off.
Yeah.
Segueing from one New Yorker to another New Yorker, and I'm seeing this trend, so I will try to keep my New York accent as down as I possibly can, but my story starts there. And many of the folks that you all have heard from thus far probably don't know this little bit of information about me. They do know that I am almost 6 foot tall. And I know there's this thing when we're all in these virtual settings, we think that we're just this level, right? But I am almost 6 foot tall. And when I was in high school, a lot of the sports teams wanted to recruit me to do something, but I have 2 left feet. So I played not a sport. But what struck me the most when I was in high school was a small group called the Clown Club. And the Clown Club would meet weekly and visit nursing homes all throughout Queens, New York, and spend time with the elderly. I had no idea at 15 that my time spending with the elderly in nursing homes would shape where I am today. In terms of listening to stories of those that families weren't coming to visit, they were isolated, they were lonely. I would be sitting there, and my clown name was Skittles. So if you see me anywhere and you say Skittles, I probably will respond before you call me Qwynn. And I would make the balloons for them, and I would hear such rich and robust stories about the lives that they lived, that they felt people no longer cared about. So fast forward, my journey of service continued. I joined the United States Army in 2001, and I have been serving in support of service members, veterans, their families, caregivers, and their survivors for over the last 2 decades. Most recently, during the pandemic, I made the decision that I wanted to become an end-of-life doula and be of support to those that were dying, that served, and be of support to their caregivers. And during that time, I reached out to, at that point, Tina was my cheerleader, my friend, and I wanted some questions answered in terms of what community models were in place to support veterans through the end of life. And Tina challenged me at that time. I can go on and on about how that conversation started, but she asked me, what was I ready to do? And that simple challenge turned our work upside down on its head. And what happened in turn was, alongside PsychArmor and Tina's team at the time, we created a collection of courses called Caring for Veterans Through the End of Life. 3 courses, one focused on healthcare providers, one focused on caregivers and loved ones, one focused on compassionate communities. How can communities do more than say, thank you for your service? How can they show up in actionable ways to make a difference in the lives of those that were aging and in the lives of those veterans that had serious and terminal illnesses? So we started having these conversations. Those collection of courses have hit close to 5,000 people across the country in less than 2 years. And where we sit today, Tina twisted my arm really hard about a year ago and said, we need to do more. We need to start looking at aging and longevity. We need to start looking at, how do we look at the end and then go back? What does this continuum of life look like across the board? So here we are. I think it was May timeframe. I took a trip to San Diego, got with the amazing team at SEAL. Steve looked at me and said, okay, what are we going to do? And when are we going to get it started? And so we began having these conversations. And in less than 6 months, here we are in unveiling what we see, what we're reimagining for our military connected communities as it relates to aging, longevity, not looking at what's the matter with our aging population, but what matters to our aging population. And along the way, Dr. Latif came on. We were on a call a few months ago, and we were talking about end-of-life care and geriatric psychiatry. And then we said, what can we do? Right? I'm going to let Dr. Latif share more about himself, but he is an amazing board member for PsychArmor. And the last 2 months, we have been rolling up our sleeves to say, what can we do together? Right? What can we do to raise this level of awareness? What can we do to inspire, to inform, to really build a narrative around what our country should see as critical at this point? So with that, Dr. Latif, I'm going to ask you to jump in and share
Yeah,
your why.
yeah,
What has led you to the work of geriatric psychiatry,
yeah,
especially as it relates to our military connected
yeah,
community?
yeah. No, thanks, Qwynn. And yes, please, it's Umar, Steve. So, no, I thank you for having me here. I think as part of PsychArmor's team, I had the privilege of being a fellow George Bush Scholar for the Veteran Leadership Program. This was a few years ago. And one of the things, Qwynn, to your question is, that centering question, even for the audience today, is on whose behalf do we occupy this seat, right? Because a lot of us are here today based on lived experiences that have informed our professional roles in one way or another, right? So I love what Steve you had said was one of the goals of what SEAL is doing is to inspire, right?
Mhm.
And you know, just a brief background. So my father, who passed away 3 years ago, was a military psychiatrist. And I wish I had the caregiving privilege rather than caregiving burden of being there more present in those times, right? And I think that's my call to action is that we're very passionate and very close to the work, but I think it's a moment to step back And how are we even framing this conversation, right? You mentioned lifespan versus health span. We talk about caregiver burden. What about caregiver privilege? What about, we talk about invisible wounds for our elderly veterans. Are we risking making it an invisible generation
Hmm.
if we don't frame this properly? Because here is a generation that has a collective wisdom that we're not listening to. We're not curating that. We're not disseminating that. And I don't think we're properly understanding or quantifying the loss of that. When we talk about, yes, our caregivers are heroes, but are we losing the true voice of our heroes in this caregiving? So those are some of the things I was just reflecting on when I was hearing the different vantage points that we've all come to. I've had the privilege over the last 20 years, twice over, co-founding clinical programs that bridge the gap between different silos. The veteran healthcare system, active duty service members, the civilian side. And one of the driving passions has been is who heals the healers, right?
Hmm.
And there is a confluence of things that we're going to talk about from my vantage point as a physician that are extremely alarming, right? So when we look at our aging veteran population, there are comorbidities that have existed, but now they're crashing together. So clinical depression and anxiety, oftentimes in our elderly, looks like physical worsening of symptoms. So we're not even paying attention to this expression of pain, how much of it is physical pain, how much of it is existential pain, right? When we're looking at medical illnesses like post-traumatic stress and traumatic brain injury, we know that those are accelerants for cognitive impairment. When we look at our aging population and the increased now risk of alcohol and prescription pill misuse, that's another amplifier. And then only now am I introducing dementia that by the time we're seeing clinical symptoms has been 20 years in the making, right? So I think there's a tremendous need, a tremendous sense of urgency for us to start doing preventative work and really take this work outside of healthcare systems to the point of contact where care is happening, care is being delivered, which is in the community. So I think what SEAL is doing and what PsychArmor are doing is there's so much synergy here that it warms my heart. Yep, there's some hope here.
I love that. I had to take some notes down. You talked about this collective wisdom and how do we ensure we don't have an invisible generation. But I want to back up for a moment because you started talking about the invisible wounds.
Mhm.
And I think about those that served way back from World War II to where we are today. Umar, I would love for you to set the stage and talk a little bit more about what mental health challenges show up when we're talking about 60 plus and even towards the end of life. And how is it impacting the lived experiences of the veteran, but also the experiences of the caregiver?
Yeah, yeah.
Hmm.
And I think you framed and set the question really with an important nuance here. And I think that's where organizations like PsychArmor and other organizations really are emphasizing the need for cultural awareness because each cohort that you started with World War II is a very different cohort.
Hmm.
The last thing that we want to do is presume that one invisible wound of one generation is similar to the other and the other, right? And we get it. All of us in this space, we get it. But we need to get them, I wouldn't put OIF veteran with a Vietnam veteran in the same group to do trauma processing, right? And so just that nuance of what unites them, what separates them, I think will help inform our research. I'm growing older with my geriatric patients. I'm board certified in both addiction and geriatric psychiatry. Um, my patients are growing older with me, but so are their caregivers.
Hmm.
And now my patients' caregivers are becoming my patients, right? So if we look at some of the alarming statistics, 1/3 of US adults age 50 and above are experiencing loneliness, right? And the US Surgeon General's report on loneliness is something that is worth reading. It's very sobering, right? And we know that loneliness can amplify medical risk factors. By some equations, it's almost as bad as smoking a pack of cigarettes a day, right? Overdose deaths in adults 65 and above, they've more than tripled since 2000, right? So it doesn't matter if you're considering that age 65 and above senior veteran or their senior caregiver, right? Depending on cohorts. And then 2/3 of caregivers who have high strain and high stress, they have a two-third high risk of mortality themselves, right? And then you add on to that this complexity of when I'm sitting with caregivers in my clinic, what's coming up is role reversals, right? Now it's the caregiver is in the parental role. And when we talk about post-traumatic stress disorder, generational trauma, epigenetics of trauma, all of a sudden that complexity is being added into the caregiver, right? So magnifications of exhaustion, just a sense of no agency and control, or even resentment, taboo topics, because we talk about the daughters, the sandwich generation, right? They're caught in between their lives and who heals those healers, right? And so the other thing that we don't talk often about is financial insecurity,
Hmm.
right? Financial healthcare insecurity, financial food insecurity. I mean, so these things, these discussions cannot happen with, I could rattle off as a physician all day long a really elegant treatment plan, but if I'm blind and not even aware of what are the barriers for that elder daughter who helped someone come in, this is a true story. When we started telemedicine, I had a patient scheduled at 1:30, and at that time the software wasn't as elegant, and I saw in my dashboard at 10:45 that my 1:30 patient logged in. So I called my office manager, said, "Hey, Beth," not her real name. I said, "Beth's logged in early. Maybe she forgot." So my office manager called, and it was actually Beth's daughter who had to take time off from work to drive across town to set up mom's iPad to get the link on so that she could make an appointment with me, right? And those are the practical things that if we don't know, we're doing a disservice in a siloed mindset of subject matter experts just rattling off these idealistic treatment plans that we can't execute on, right? So I think hearing the voices of the caregiver, hearing the voices of our aging, older veteran population, I suspect we're going to learn a thing or two that we thought we knew, but we didn't.
Absolutely. Absolutely. Taking it a step further. So you talked about this piece with your client bringing in the iPad, right? And when I was down in San Diego with the SEAL team, there was an extraordinary gentleman that was sharing his work in terms of educating those that are aging how to use technology, right? So I see that as such a practical and great strategy. But what are some of the other bright spots,
Yeah.
Umar, that you're seeing that can give some of us hope that, for some of us who are providers, for some of us who are
Yeah.
caregivers ourselves
Yeah.
and veterans,
And
Yeah.
some of us who are policymakers.
and some of us who
Yes.
are New York
So,
policymakers?
yeah.
It doesn't
Yes,
have to be New York. It doesn't have to be New York.
across the board.
Yeah.
Absolutely.
No, and I love that, right? Because no single system can do it on our own, right? And we really have to pull in, like Steve, you're saying, policymakers. We need to have social scientists. We need to have clinicians. We need to have, universities, partnering with nonprofits to get access to funding. We need to have education platforms like Best in Class, PsychArmor. I'm a little biased, Tina, I'll just say it. But we need to get them into driving cultural competence and cultural awareness and cultural humility into our clinicians across the board. And we have to be able to scale that. So I am hopeful where technology can help, utilizing AI with guardrails to deploy and amplify some of these things, but creating ecosystems where integrally there's a cross-pollination of thought and idea and solutions and stuff. I think so. We're seeing that. So I'll give an example in the geriatric psychiatry world. There's something really promising happening with Medicare that is looking at collaborative care model where there are not enough geriatric psychiatrists out there. So what you're doing is you're bringing behavioral health care into an embedded primary care model, and you've got consultants who are just consulting on um, what's the best science telling us in early detection of dementia and Alzheimer's. So you're narrowing that last mile gap, and you're disseminating actually point of care tactics to where they belong. So I think utilizing technology platforms, utilizing educational platforms, and having um, uh, true proper stakeholders, not just the ones that are driving the dollars onto the table, I think is critical. And today's a good example of this. Yeah.
Absolutely.
Yeah, I would just add that, and Qwynn, and then you can add that next question. I think I agree with you. It's a community-wide issue, so the whole community needs to be involved. And so that means CBOs, that means caregivers, that means clients, that means government, it means academics, but it also means industry. Because what's clear to me, and I'm very proud of what SEAL has been able to do, is if the for-profits are not involved, it's not likely that whatever you develop will be sustainable because funding streams come and go, leaders come and go, priorities come and go. But if industry is involved, then I think we have a chance to not only develop what's needed, but also be able to sustain it and, as you say, make it iterative, that we're going to learn something and then, we'll learn some more because we're in the process of, my guess is a 10 to 15 year, how do we want older people to be included in our society?
Yeah.
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 Sorry, I couldn't resist, Qwynn.
No, yeah.
No, I love it. It makes me think of, there's no wrong door, right? How do we ensure that everyone is able to see themselves? Everyone is able to see themselves in providing some level of support, even if that means a warm handoff to the right support, right? There is no wrong door when we're looking at the data, we're looking at the stats, and knowing what the next 10 to 15 years are going to look like. And so I look at what we are all doing together as such innovation as we are preparing for what's to come. We hear it all the time. There's this tsunami, there's a tsunami, there's a tsunami.
It's here.
But it's here. It's here, right? It's here. And so it takes voices like ours to be able to amplify the message and to make it real and to allow people the space to envision what it looks like for them to be a part, right? So with that, I am going to, Umar, I'm going to ask you one more question. If you had a magic ball or a view into the future, and you can design an ideal system of support, what are some of those things that you haven't mentioned yet that you would include that we do not have yet?
How many zeros are you gonna donate to me for that?
I'm going to give you all the love in my heart that I have.
I think one of the things that we need to move beyond bureaucratic bottlenecks, right? And even in healthcare, right? If you really zoom out and look over the last 10 to 20 years, 80 to 90% of healthcare dollars have been spent on drugs and devices because you can convert that into profits, which I'm not against. I'm absolutely not suggesting one way or another. but we've not really moved into preventative care. We've not really moved into functional healthcare. We've not really moved into, because a lot of the energy, the 80-20% rule, right? We're spending so much healthcare dollar in things that if you really step back over the previous 10 or 20 years, majority of those things were preventable. The whole conversation is shifting in geriatric care, where someone who had two ApoE4 alleles is not manifest destiny that they will develop dementia, and that is a, God forbid, one-way ticket. It's like the big C cancer word. There's about 17 to 20 modifiable factors that don't require a lot of funding for, that we need to start deploying into our community. So I think the preventative aspect of this, because by the time someone's seeing us as specialists, we've already seen all that time lost where interventions would have actually made. So the knowledge is sitting in silos, right? I mean, there's elegant, good, evidenced, and that's the other thing, which is a whole other conversation. We need to start expanding this limited mindset of evidence-based versus a more holistic, evidence-informed approach, because time isn't there for us to set up, these double-blind controlled studies when translational knowledge exists today. So I don't know if I answered that question, but I think we need to move things into a reactive to a preventative model and start thinking about that.
Well, I think you just identified the next issue brief which is going to be those 17 to 20 identifiable preventative
Yeah.
attributes that we can make a difference
Yeah.
on.
And Qwynn, just one last starting point. Now, what I'm telling medical students and trainees is in geriatric psychiatry is every one of your patients who is in a assisted living facility and a nursing home, all of their adult patients who are in their 50s and 60s should start getting much more comprehensive assessments with a functional approach so that we can start implementing preventative stuff today. Yeah. So rather than waiting for them 20 years later to come see you.
Thank you for that. You've not only, if SEAL is supposed to be inspiring other people, I think you just inspired me. I look forward to working with you. But we've been hearing it from a policy and a practice level and a program level, but now I want to make sure that, at least on this webinar, we also hear it from the personal voice. So Michelle, gift us with your experience, your interview with your grandmother, who is a military caregiver.
Yeah, thank you, Steve. So my name is Michelle Matter. I'm the Director of Aging at SDSU CEAL. And like Steve mentioned, my connection to the military starts with my grandparents. My grandfather served on the USS Enterprise during World War II. And I know he would want me to share it was the most decorated ship during World War II. But the CV-6 was a huge part of his identity. And when I was a kid, I watched my grandparents plan Navy reunions every year. And so that connection to service is just one of the reasons that I'm so passionate about this work. And hearing Tina mention the RAND study with the Dole Foundation, it reminded me of one of my greatest memories. Actually, my grandpa took me to a VFW luncheon one time and introduced me to Senator Bob Dole. And so just connecting some of my favorite experiences with the work I do today, just kind of feels like a full circle moment. But today I want to talk about my grandma. She turned 90 just this month on September 12th. And she became a caregiver in her late 40s, actually, when my grandpa was diagnosed with lung cancer. My grandpa passed away. He was only 50. But after he passed, she learned about a support group at the Naval Hospital for widows and widowers. And she'll talk about that in just a minute. But years later, after remarrying, she once again became a caregiver. And at this time, for a longer period of time, really had to put her life on hold to care for her husband. And it was hard for me to see just how she became so homebound, giving up so many of the things that she had been passionate about her entire life. Was a Girl Scout leader for more than 50 years. She sold Avon to hundreds of people in the community. But she really had to start just focusing entirely on his care. And At the same time I started to see this was when I started my role at SEAL, and Steve brought me in to really start our caregiver training and peer support program that he talked about. And like you mentioned, in just a couple of years, we'd have over 7,500 participants. And it really just shows the need that people have. We initially started the program to really have, to increase and diversify the direct care workforce, looking at paid caregivers. But we had so much of an interest from friend and family caregivers that it quickly expanded. And while the training was important, what was really impactful was the peer support element. And we saw how these people were coming together and just sharing resources, talking about both challenges and some of the wins they had as being a caregiver. And it just really was something that I thought could help my grandma. So I encouraged her to join one of our peer support groups. Initially, she made excuse after excuse why she couldn't. She couldn't leave my new grandpa, but I told her, no, Grandma, this is online, and I'll set you up on Zoom. And nobody wanted to hear her story, she thought, but once she finally was convinced to do this, this really was transformative for her. She had so much to share that she eventually became a facilitator for other groups. And as she began connecting with caregivers, a lot of them talked about the importance of staying active. And that's something that she just wasn't doing. All her care was focused on her husband. And so she started going to events at a local senior center. And there happened to be a presentation about VA benefits that she wasn't familiar with. She's shared with me that that taking time to do something for herself wouldn't have happened without that peer support group, without hearing from others that that was okay. She's also shared with me how many World War II veterans and their families hesitate to ask for help. For that generation, it just isn't comfortable. And so we've mentioned here, just many of them don't even see themselves as caregivers. To them, it's just what's expected of them, and they don't expect any help in return. But being part of a peer support network changes that narrative. It helps to recognize that there's a value to taking care of yourself. Connecting with others who understand what you're going through, it really makes you feel empowered to ask for support without feeling guilty to do so. And so one of the things that I've talked to her about is just how important it would be to have a peer support group specifically for military families who truly understand some of those unique challenges of service-related health issues. And most importantly, as my grandma talks about, is navigating the VA. So she's got a powerful story, but I think it'll be more impactful if you hear her own words. So if you don't mind, I'm just going to share about a 5-minute video of my grandma talking about her journey.
I'm Peggy Olson. I became a Navy wife in October 10th of 1953. I lost my first husband on October 22nd, 1983, at 30 years and 12 days after we were married. It was quite a shock to become a Navy, to widow so early, but I had immediate help from the Naval Hospital because they had a great support group. And we had to attend classes, and then they had a potluck for all of us at a graduation ceremony. And it was through this group that I met my second husband, who had served in World War II. And even though he was 14 years older, at that time it wasn't such a big deal because I was 48. I did peritoneal dialysis on him for 2 years. And for some of you that don't know, peritoneal is done through the tummy rather than done through the veins. After 2 years, he got an infection, and he had to have all those tubes pulled out, and he had to have then hemodialysis, which was much better for him. He started eating better. Part of his not eating, he didn't have enough protein, which causes infection, and he just couldn't eat it. But once he got on hemodialysis, things were much better. But he spent over 9 months, 5 times in the hospital and 5 times in the nursing home in 2017. He ended up being that I could not go he was, after that 9 months in the hospital. He was a total invalid. I could not leave him. So I didn't know about a lot of help. I went to the senior center and we learned about things that we could get from VA. And he applied for VA and he was awarded 100% VA disability, which then paid for out of pocket what we had been paying out of pocket for his transport to dialysis. At the end of his death, he had used up all of his good veins. He needed a pacemaker. There was no place for him to get a pacemaker because all the veins had been used up. And then because he couldn't get a pacemaker, he couldn't get his dialysis, so he was double doomed. But in that time, for the last 7 years of his life, I had to always go do my shopping, do everything that my own doctor's appointments. And I also had a very bad kidney stone infection, almost killing me. And we had to literally put him in a nursing home so that I could end up going to the hospital. And so these are some of the things that you have to deal with when you're a caregiver. You have to have a babysitter when you need to go because you can't leave them. There's no one to help them if the house caught fire or anything. He always said, oh, you can go to the store, but I always felt like I couldn't. So anyway, it's a horrible thing trying to be a caregiver. And I'm so glad that Michelle's working on things that can help all the seniors in the future. And that was the great thing about the support group that we had for the military spouses, but they didn't do so much on caregiving. They did mostly on just being a widower. But they really need something like that. We really need a Navy, because Navy things are different than civilian. We have special things for the Navy people, and we need to know about those. And sometimes we don't always hear about them. Yeah. For a while there, they were not giving palliative care at the Naval Hospital. Now they are. So it is an improvement over what it has been for several years. So that's a good thing. But we need more things that tell us exactly what we can get and what's available for us.
All right, thank you so much for letting me share that video from my grandma. I was going to have her come live, but that was part of a very, very long conversation that we cut down. So once she gets started talking, she doesn't want to stop. I mentioned she, was reluctant to feel like her story was important to others, but once she started to realize that other people could feel that and she was getting stuff from others as well, it really shows that power of peer support. And I think it just reiterates why this partnership with PsychArmor is so meaningful. My grandma, until she met with other caregivers, she really didn't see how isolated she really was. But connecting with others, it just shows that there is a sense of community. And she talks a lot about how important it was to have this support group after my grandpa died, but there wasn't really something before that to talk about what she might need to go through, kind of the process, what caregiving was, training. And so it's exciting for me to think about how someone like my grandma and others can help us shape this program. I've asked her, what kind of information do you wish you had, or what kind of training would have been helpful? And so I think that is just the biggest part of this, is to really listen to others and not create something that, we don't all necessarily have all of this experience that people have, but collectively we can shape something really incredible. My grandma's also started encouraging some of her own friends to join peer support. She recently had a friend who was widowed and was like, you should become a peer support facilitator. One thing she always says is that when she lost her husband, she didn't just lose someone that she loved. She lost her job and her sense of purpose. And so by becoming a facilitator and talking to others, it's given that back to her. And I think we could see that happen for so many others. Dr. Latif talked about that isolation and loneliness, but just this opportunity to connect with others can be, so impactful on so many levels. This is just the culture that we want to build with this partnership, is just this opportunity to hear from people. And We have a web page we've set up, and I'll put the link in the chat, but there's an interest list there, and I encourage you to share that with others. We'll post this webinar after today, but just that we want to collect these stories. We want to get this information, and we want to get people talking about their experience and just sharing just how important it is to get people connected into this community. So with that in mind, I'll hand it back over to Qwynn to guide a discussion on what our community needs to be even stronger caregivers.
You know, Michelle, I was sitting here and as I was listening to your grandmother, it was taking me everything not to go off camera from choking up, right? I know there was a moment where you were worried if you were going to choke up. I felt the choke up. Because what I heard your grandmother share was she sees you, she sees SEAL, she sees this partnership as the future, right? How we can ensure that we're not creating an invisible generation, that we are creating a visible generation where we're saying front and center, you matter. We're saying you are at the center of all of this work.
Yeah.
But what I also heard was hope. The legacy that your grandmother wants to see hope. And there's nothing like a good old school military acronym. And so if I say hope, it truly is an acronym for hearing other people's experiences. And when we're able to hear other people's experiences, it gives us hope to add a little nugget to this collective wisdom that we're building, this impact that we know that we're going to have, this reimagination of what could be if we do things together versus in silos. So I know we have a few folks, and Leah, you can get me on the back end. It is fine. You showed up. So with you showing up, that means I'm going to ping you a little bit. Ginger, you also showed up, and I think there are a few others that are on this call, but primarily because I know Ginger, you noted that you are in hospice. I know that this is a part of, I'm going to make the assumption that this is a part of your work and what you do on a day-to-day basis. Leah, I know you have touched the continuum from aging all the way to survivorship. So from where we all sit in this space, and what I love about just this conversation, we're building this ecosystem that's including community. It's including caregivers. It's including providers. But I'm going to flip it on its head for a moment and ask our audience members to share a little bit, allowing us a look into your worlds through your lens, right? And tell us and help us guide more conversations in what are the supports you see this population needing? What are the supports that you see organizations and systems needing to ensure we're caring for our aging veteran population and their caregivers?
Qwynn, I'm surprised that friends of yours are shy and aren't speaking up.
They're thinking.
Oh, okay.
Okay. We need more user-friendly technology for older veterans. Michelle and Steve, do you remember the gentleman that was during that panel? Can you share a little bit more about his vision and what his organization is doing? And he's a veteran, if I'm not mistaken, as well.
Yeah. A former Marine officer, Cole Samaroff, and his organization is Digital.
Senior Tech Connect.
So he's been partnering with us, and we'll put that in the chat and in the resources afterwards, because I don't know how to tell you this, but my 92-year-old mother-in-law is more on the internet than I am and knows better about it than I do. I ask her for help. So the assumption that older people don't know is erroneous. And I was just struck by the statistic a couple of weeks ago that 84% of people over 60 have a smartphone. Now, they may not know how to use it, but it's available. So really it becomes a question, and that's why we partnered with Cole and Senior Connect. to begin to make sure that everybody has that information. He's working now with health plans in various places as well as senior centers, and it would be not a problem at all if that becomes an identified need, either generally for older adults who are involved with a military caregiver and their families, or specifically in certain locations. He goes all over the country. He's on mission. You should know.
Yeah, yeah. I think that's so helpful, right?
Yeah.
When you think about, just automated systems and you think about how groceries are being delivered now, there's an app for this, there's an app for that. And in my, 4 decades of living on this earth, technology is going way too fast for me. I can only imagine what it's like to be a senior and
Mhm.
try to figure out how to adapt to this society that feels like it's moving fast, right? I think that's a great idea as we are building and exploring is how do we make technology more user-friendly for our older veterans, right?
Yeah.
Where it feels more comfortable and
Yeah.
it feels second nature for them as much as possible. Umar, I saw you raise your hand.
Yeah.
I just wanted to add briefly that as we're designing these, user-friendly technology pieces, interconnectedness needs to be part of the design from day one.
Yeah.
Right now, I can't even get my electronic health record system to be downloaded on my patient to get to another system uploaded. And so if we don't look at an ecosystem where all of this data is not being brought into a central place, it'll end up with zero-sum game, user-friendly technology that is critical, but it's sitting in a box that doesn't talk to the second box kind of
Right.
stuff.
Yeah.
Yeah,
Rollout details.
absolutely. Tina, I see your message to Leah. You want to jump in?
Yeah. Well, I'm also going to on the technology because we do have a bunch of individuals here that sit within the service profession. And I think part of our challenge as professionals is to also make sure that we're immersing ourselves in the place where technology is being created. So one of the best experiences I had was going to South by Southwest and sitting in the caregiver track for, 2 full days. And it was my favorite thing was to grab the microphone and see if there was any other social workers sitting in the room. And what I just meant was the individual that's sitting on the receiving side of where all the investment and technology producers are at, because I want to be involved on the front end, right? And everything you all are saying, somebody is designing the technology for the future. Are we at the table? So I think the challenge for all of us is to also get into the other industry so that we can help influence that and then make really interesting companies that want to be able to implement, but they haven't worked the policy end because that technology is not allowed. And so we're seeing that a lot right now with AI. So then we have to also be smarter for those sitting in the academic institution, SDSU. You have that opportunity to go across your schools and find out where that's being done. I placed something on here just to share as a story around that. The heart of the pandemic, my at that time 102-year-old, 103-year-old grandmother had been isolated in her room in Florida. And the conversation was I couldn't even send photos to my grandmother, right? And it took looking at instead of all the barriers to what was out there and hear from just this simple thing of wanting to get photos so she wasn't alone, ended up with a technology that was meant to be super user friendly that you could program as the family member on what they got. Because like the other worry is what buttons are they going to push? I could go through all the worries, but instead of the worries, it was what was the capability. And at the end of the day, it wasn't important. What was most important to my grandmother? Yes, she liked getting the pictures. Like, yes, she knew how to push the button to get to one of us. But when she needed just to talk to someone, her little pad wasn't working, quote unquote. She would go to chat, get to have a nice conversation with the chat person over there. My pad's not working, but the chat people, again, to the consumer side of it or the customer experience side of it, the technology making it needs to think about what might other things you be filling as you're answering these questions for these individuals. Her pad was broken every day, basically, so she could chat with the customer service person. So I think in these simple places is a really unique thing. I'm going to bounce from Leah here because Leah's taught us a lot around respite and something that just happened for me this past week. And I will mention the company because it's worth mentioning, of no favoritism, but just to say, and the reason why is Amada Senior Care. So they're doing specifically the caregiver work. The founder of that company, Tafa, his mother was a caregiver, a paid caregiver. That's what she did. So he grew up in a home honoring his mother's work and what she did, and seeing that translated into this big 6 foot something former professional football player to really lean into the opportunity of this caregiving, which to Leah's point is truly respite care. And this is something you all spoke about. Michelle, you honed in on this. The number one barrier to care is the acceptance of a generation that does not want people in their home and does not want to have to ask for help. So our question was, how do we help veterans see that this is something that is supportive in their home? And what I hope will happen in this partnership is we'll tackle it from the family member and the caregiver that has the opportunity to open the door for us. Even if it means that that's not the caregiver that's going to continue as the caregiver, there'll be either a respite or there'll be a full-time care, not full-time, but you know what I'm saying? And so I think that there is definitely this culture shift or working with the family members that is key, that's been highlighted here, because the services are there. It's the acceptance. So as to Steve's, his wonderful introduction to all of this, I take this to task too, that within my own family, I have these conversations that it's okay to be supporting me as I age, that I'm not going to be resistant to that. And I need to be as curious as my family members. That'll make it better for me as I age, right? So anyways, that's just a few of the contributions there. And yeah, I think, Leah, thank you on placing that respite is critical.
And just to follow up a little bit on that point, and Michelle might go deeper in the synthesis towards the end, but as we speak, when she talked about how we engage the paid and unpaid caregivers, families, and friends, well, we now have 14 to 16 peer support groups that meet every single month. They're all virtual, so they're easily accessible, and we need to have some of them we need to help set up in terms of technology, but they're doing what you just described. How do I feel comfortable with somebody else so I can do it this way? But out of those out of that peer support group and sharing experiences, they start to socialize and they create a sense of belonging, because if we're going to focus on health and well-being, you can't do that by yourself. You got to do it as a part of a community, a part of belonging. And so our focus is really involve, inform, and inspire so that people see their circumstances with a new lens. I don't know. I hope I didn't take all your thunder, Michelle, but I know you'll add more.
No, it's good.
Qwynn, what else do you want the audience to ask? Because I thought there was a comment about fraud, and that is the danger, and that's why Senior Connect teaches, fraud protection. We're also doing a 3-part webinar series starting in January with legal aid about how to protect yourself. It's such a big issue because as people raise these issues, we try to figure out a solution, much like what we're doing with PsychArmor. San Diego is a military town. There's hundreds of thousands of people. Most of them, there's a section that are younger, but most of them have been here for 10, 20, 30 years. A lot of them come here and then just retire here. And so this issue, and I'm really excited about how PsychArmor is thinking ahead of time. These will be the issue over the next 5, 8, 10 years. And so let's get ahead of it so that we can help people see their next years as opportunity and purpose, not as loss and decrease and decline.
I love that. And I think you hit it on its head, right? Looking at these conversations, looking at how partnerships like this can become a blueprint for around the country where, this model that we're creating may work in an urban area, but how can a rural community do something similar using a similar framework? Just understanding how important that involve, inform, inspire, what that looks like, and how can we create more age-friendly communities, so to speak, right? So with that, and I'm looking at the time and I'm like, where has this 90 minutes gone? But I want to turn it back over to Michelle, because Michelle, I want you to land this plane right where you wanted it to land when we first met, and getting everyone that's here with us today and everyone that's going to watch this in the future to know that they are a part of this conversation. Heck, we're just going to call it, they're going to be a part of this movement, because we are changing the way that the paradigm is set now. We're shifting it. So Michelle, I'm going to turn it back over to you.
I have to just start with, I remember when I was about to turn, I think 17, and I told my grandpa, I really think I want to join the Air Force. I want to fly planes and land them. And I remember specifically him telling me, if you're not looking at the Navy, then I don't want to have this conversation. So it's funny to hear you use that analogy. But this discussion has just been so powerful. And I think it really is just the beginning of how we're going to start to support military caregivers. I think Dr. Latif said it best. There is just no one size fits all solution. It's going to have to come from so many angles. And we talked about so many important topics today. We talked about the loneliness, financial security, what's preventable, some of the barriers. We heard stats and stories, and even the hearing from my grandma just reminds us of why this work matters and what the real-time needs are from the community, hearing about technology. And I think there's so many people that are doing great things, but you're right, if it's not getting what you need. I had dinner this week with someone who's created a product, and it's a handheld device. And I asked about, is this waterproof? Because I've noticed in some assisted living facilities how often people are drooling, for example, and this device can get wet. And so, kind of those kinds of thoughts make you just think a little bit differently on how important that lived experience is in co-creating everything that we do. So I just want to kind of talk about, what I've heard today and what I think some of the next steps should be. One is really to continue examining what those needs are from the community, especially across generations. My grandma mentioned that she had this bad kidney infection and she nearly died, and she really almost did. She was not feeling good. My son had a performance the night before, and she called me and said she wasn't going to make it. She wasn't feeling well. And when I called to check on her the next morning, and I said, "How are you feeling?" She goes, "I'm okay." I said, "Do you think you need to go to the hospital?" No, I'm fine. I don't need to go to the hospital. I checked on her a couple hours later. She didn't answer the phone. So I went to her house to check on her and found that she was in dire shape. In fact, when I took her to the ER, she had such a bad kidney infection. The doctor said maybe 30 more minutes of not coming to the hospital, and she probably wouldn't have made it. But the reason she was afraid to leave was she did not want to leave her husband. It was like, who's going to care for the person that I care for? I'm a caregiver, so therefore I can't take care of my own needs. So I think really understanding that from a generational perspective, that, like you said, some of this World War II generation, they don't want to ask for help. They don't know how to ask for help. And instead of her just saying, yes, I can go to the doctor, can someone come and stay here? She was so afraid she'd be admitted. And what ended up happening, she waited so long, she was admitted for 3 weeks to the hospital. So it plays a toll. I think we also want to elevate the lived experience with caregivers. And we've talked about that quite often on this webinar, but just that those voices are going to inform the programs and the needs to really be a more responsive and equitable program that we create together. And then finally, the importance of training and peer support. So I think there are so many opportunities for people to learn different things, but it's not all in one area where people can go to. And what we're talking about looking at doing is really having a resource that people can go to and really see what programs are out there, what resources are out there, how can I connect with a caregiver group, how can I become a facilitator? And so all of those things, having this resource for military connected communities is what we're looking to grow. So I mentioned earlier, we've set up an initial web page. This is just almost bare bones for now until we really start to develop this, but I'm going to put the link in the chat and encourage you to sign up for our interest list, and then share that with others. Like I mentioned, we really want to hear these stories. I would love to get a collection of videos like we had of my grandma where people are just giving little tidbits of what's meaningful to them. You can read it all day long, but when you see it and hear it, it just kind of hits a little bit differently. So, so I'm so grateful for your engagement today, and I'm happy to turn it back over to Tina and Steve to close us out.
For me, it's 6 months seems like a long time, Qwynn. I think we need to accelerate this. I don't want to wait another 6 months, just so I'm clear on the record. I would like by the end of the year that we got a whole thing laid out for 2026. What we're going to do each quarter, each month, who we want to engage, and we just divvy up who does the tasks. We'll expect Dr. Latif to help fund us, but we'll work out all that part as well. Because I do believe that we've seen the nexus of how we're working and how you're working overlap to make a difference and a significant difference, listening to Michelle's story, for a population that has done much for our country, and this is the least we can do in response. And so I look forward to doing more webinars, doing some doing presentations, developing programs here in San Diego, but as you so eloquently point out, it's a national thing. I could see us beginning to engage senior centers where they're offering military groupings. I could see American Legion. You guys have a much better relationship and connection to the VA. They may have some places that they want us to go. But I think there's 15 million people that we want to engage so that they can say they're having the best days of their life. All right, Tina, it's on you now.
Well, that's a nice closing for us all to have the best days of our life. I think you've all talked too about helping those that are helping others, and that includes us. And so I think a strong weight on my shoulders is wondering if we are leaning in the right direction, if curiosity is in the right way. I think we validated that amongst ourselves, which is easy to do sometimes, but we know this based on many things. And so my call to action is hopefully this video here will expand and we'll share it with our partners. We do need the support from others that are out there leading this work to have us involved in their work, as well as the planning of their work. And so I look forward to the way that the SEAL and PsychArmor team can collaborate with those that are in the front lines of this work, as well as, like we've highlighted here, the businesses that are moving forward in this area of support, and the local leaders. So hopefully we will have a stronger collaboration behind us as we continue to push this work further. But also, just in terms of the work from the SEAL team, thank you for trusting us as your partner. We are very grateful for that. Umar, thank you as one of our board members for furthering this as one of our strategic priorities, and the support from the board and your leadership and your expertise. I sincerely appreciate it.
Qwynn, Umar, last thought, last word?
No, I think just involve, inform, and inspire. I think that's the galvanizing kind of focal point here. So looking forward to next steps. Absolutely.
I too.
Gratitude, and thank you for those who have joined us today. We hope that you are inspired to do something amazing in your communities and to also join forces with us as we build this out. So thank you for joining. We hope that you listen. We hope that you share it out far and wide, and let's get this momentum built.
Beautiful.
Thank you.
Thanks,
Thank you,
everyone.